Hello, how are you? Some people wake up in the morning with a really dry mouth and think that's completely normal. Just because you went a few hours without drinking water, it's no big deal. You drink a glass of water and move on with your life. It could be something simple, but it can also be a sign your body is giving you that something is seriously wrong. And it's very important that you identify this as quickly as possible for the sake of your health. In this video, I'm going to tell you the main causes of dry mouth, what its relationship is with blood sugar, diabetes, metabolism, whether medications influence this, the impact, especially in older people, and what you can do to improve this, and even better, improve your health. This video is very important, so stay until the end because you won't want to miss it. Before we start, I want to ask you if you wake up in the morning with a dry mouth, like you woke up with a desert in your mouth. Does this happen to you or not? Tell me down below in the comments. First, we need to understand that this dry mouth can be related to a decrease in saliva production. Saliva is produced by our salivary glands in the mouth, right? And it is made up, obviously, mostly of water. But saliva also contains digestive enzymes, minerals, proteins, antibodies, antimicrobial substances. In other words, saliva is part of our mouth's natural defense system. With this, we start to realize the important role saliva plays in helping to control bacteria, protect the teeth and gums, maintain the balance of the oral microbiota, the bacteria that colonize our mouth, and facilitate chewing when we eat, and also help with swallowing. In fact, our saliva contains enzymes that begin the process of digesting carbohydrates right in the mouth. So, when we are unable to produce saliva properly, there is a greater tendency to develop cavities, increased tooth sensitivity, a higher likelihood of bad breath, more gum inflammation, more infections in the mouth. Therefore, many people only start to notice that they are producing less saliva when they begin to experience these signs and symptoms. These are all vital points, and they really deserve a more in-depth conversation. After all, dry mouth is not a disease, obviously. It's a sign that something much more serious could be happening to you. Of course, the first thing we think of, as I mentioned at the beginning of the video, when you think of dry mouth is hydration. This is actually one of the most common causes. A lot of people spend the whole day drinking very little water and only realize it when their body gives those strong signs of thirst. Older people tend to drink less and less water, especially because they urinate many times throughout the day. And unconsciously, they start to consume less water to avoid too many trips to the bathroom, or even during the night, right? So the person ends up getting dehydrated without even realizing it. In addition, excessive consumption of coffee, alcoholic beverages, living in a very hot environment, sweating a lot. Obviously, if you've had a fever and sweated too much. This can make things worse and increase that sensation of dry mouth. But there's another very important point for your health related to waking up with a dry mouth that many people don't talk about. One of the most common causes of dry mouth, especially when it's particularly noticeable first thing in the morning, can be diabetes or poorly controlled blood sugar levels. Because when glucose levels are very high in the blood, the body tends to try to lose more fluids through urine to compensate for this, and that promotes dehydration. In addition, elevated blood glucose levels can also impair the normal function of the salivary glands, reducing saliva production and contributing to dry mouth. And do you know what's concerning? Sometimes the mouth can be one of the first signs the body gives that glucose is out of balance. Especially if, along with this dry mouth, you feel very thirsty, right? Obviously, you must feel it. A strong urge to urinate, fatigue, slightly blurred vision, more hunger than usual. So here's something very important, right? Nowadays, many people live with a pro-inflammatory eating pattern, consuming a lot of sugar or foods that quickly turn into sugar, like white bread, white pasta, white rice. A lot of soda, a lot of boxed juice, ultra-processed foods, and even refined flour, as I already mentioned, are used in many preparations. A sweet treat here and there all the time, so you end up having constant glucose spikes throughout the day. This doesn't just affect our weight. It impacts blood vessels, circulation, gut microbiota, our energy, increases that issue of low-grade chronic inflammation, and even saliva production. In fact, scientific studies have already determined that people living with uncontrolled diabetes are at higher risk for oral candidiasis, periodontal disease in the gums, infections, and may have worse healing and significant changes in the oral microbiota. So, we know that our mouth is a true ecosystem of bacteria, just like our entire digestive tract. And saliva helps precisely to maintain this balance. So, when saliva decreases, as I mentioned, the mouth becomes more acidic, more unbalanced, and there can be a greater proliferation of harmful bacteria. This is very important because the type of bacteria that grows in your mouth ends up being swallowed as you eat. So it also ends up in your intestine and can increase the risk of intestinal dysbiosis. So it's very important that we manage this dry mouth throughout the days, especially if you have more complicated blood sugar control. Of course, there's another very common cause, which is related to certain medications. This happens a lot after the age of 50 or 60 when we start having to take medication for certain health issues, right? Sometimes a person starts taking antidepressants, antihistamines, blood pressure medication, diuretics, some anxiolytics, and other medicines that can reduce saliva production. So, if you noticed this when you started taking the medication, obviously you should never stop taking the medication on your own. That could be extremely dangerous for your health. The important thing is to talk to the doctor who prescribed the medication so they can try to help you with this, either by changing the time you take it or adjusting the dose, or by switching to a different class of medication for the same purpose to reduce this effect. Another thing that can cause you to wake up with a very dry mouth is breathing through your mouth during the night. A lot of people sleep with their mouths open without realizing it, and that's terrible because it completely dries out the oral mucosa during the night. The person wakes up with a dry mouth, an irritated throat, bad breath, a rougher tongue, and this can be related to rhinitis, which causes everything to get blocked, sinusitis, a deviated septum, allergies, or some more significant nasal obstruction. So it's important to find out if you sleep with your mouth open because there might be some kind of treatment you can do to improve your breathing. This will help reduce the feeling of waking up with such a dry mouth. There's also something else these days that we always talk about, which is the issue of anxiety and chronic stress. When our body goes into a state of alert, what we call nervousness, it reduces some functions considered less of a priority at that moment, and one of them can be salivation as well. That's why many people notice their mouth becoming dry before a test, a stressful situation, or a medical appointment they're anxious about. However, if this stress response becomes chronic and part of your daily routine, dry mouth can also become a persistent everyday problem. It can be a way to notice whether you are more stressed or not. There is an autoimmune disease called Sjogren's syndrome. And in this condition, the immune system attacks the very glands in the person's body that produce saliva. So people with very dry mouths, dry eyes, significant fatigue, difficulty swallowing may need medical evaluation because it is a very specific case, but it's also worth mentioning that it does exist. So let's think now about what can help you reduce that feeling of dry mouth in the morning, which I know is super uncomfortable. The first thing, of course, is hydration throughout the day. It's not about drinking 4 cups of water before bed because then you'll be waking up all night to urinate. That's not the idea. But if you keep your body hydrated throughout the day, you'll already be more hydrated by nighttime as well. And probably that sensation will be worse right in the morning. Second thing, if you smoke, if you drink alcohol, try to cut back on that. These types of, I was going to say foods, but alcohol isn't a food, and cigarettes even less so. But these kinds of things you consume really decrease your saliva production, especially before going to sleep. The third thing is to check your glucose levels, your metabolic health. As you saw, uncontrolled hyperglycemia can be a major risk factor for increasing that sensation of dry mouth first thing in the morning. Another thing you can do to help improve this symptom is to eat real food, less ultra-processed food, less excess sugar, and consume more protein, more fruits, vegetables, and greens, foods that are naturally rich in water. And these will help keep you hydrated without much effort in your daily routine. Some foods that are slightly acidic can help stimulate more saliva production through the salivary glands. So lemon itself, radish, foods that are naturally more acidic, they can help in this regard. Some people notice a big improvement when they start adding a few drops of lemon to their water. It doesn't have to be lemonade, just a few drops of lemon. Or using slightly acidic foods in your meals. That can be an interesting option. So I want to know from you, do you usually struggle with this in your daily life? Do you have this really bad discomfort when you wake up in the morning? Write to me here in the comments. If you know someone who could benefit, share this video. Let's expand our chain of kindness. And if you can, go ahead and like the video. That's super important to me. See you next time. Bye.